COVID-19 as much as possible.
Hi guys!
Your grocery stores will be open. I have checked on our whole supply chain for food and it will be accessible. Do not panic, do not hoard. These services will remain open. The pharmacy will too, so you can get more prescriptions. Your banks and credit unions. You can fill your car with gas. You can find the full list of critical services that will remain open at michigan.gov/coronavirus. Remember, you can go outside, get some fresh air, walk your dog. Just be smart about it and maintain that 6-foot difference between you and anyone else. And one more thing on the topic of school closures. This order means that our schools will remain closed at least through April 13th. I will have more to say on this subject soon. Now, I know this is hard. I know this is going to be disruptive, and it's certainly going to be hard on our economy as well. But our action will save lives. In the long run, doing this now shortens the time our economy suffers. When we look back at this, we've got to be able to say we did everything we could. On a personal note, I know that the lack of control can be disorienting. So I urge you to focus on what you can control. This crisis can take a toll on our mental health. Check in with family. Call your loved ones. Go for a walk. Read those books on your list. Or even go outside and put your holiday lights back up. We must keep our wits about us. That means all of us. Be sensitive to how our kids are feeling. They are not immune from the stress that is going on in this environment. Check in with them and help them understand and give them the reassurance they need. Young people, I'm talking to you now. You're not immune from this. You can get this virus. And in fact, 40% of the hospitalizations and positive cases are among people 20 to 49. You can carry this without even knowing it and be unknowingly exposing others to it. If you don't take this order seriously, we will have to observe these situations longer than we need to. So, to everyone, please be smart. Follow the order. Think about the daughter who has asthma, or the grandpa that has COPD, or the sister who has MS. For the countless healthcare workers who are putting their health at risk to keep all of us cared for. And do it for yourself. We're working to prepare for the long-term economic challenges of this crisis. They will be immense. From unemployment to helping our businesses get back up on their feet. Coming back will take time and it won't be easy. We're working with the business community to help Michigan businesses and employers weather this unprecedented crisis. And we will keep working around the clock to keep Michiganders safe. Please continue to do your part. Stay home. Wash your hands frequently. Avoid touching your face. Cover your mouth with your elbow or your arm. Stand 6 feet apart from one another. And if you think you should be tested for coronavirus, call on the phone. Call your healthcare provider. Our aggressive action today will help mitigate how many people get sick and how long our economy suffers. I've seen some remarkable things in this time of crisis. This is a test unlike any we've seen before. We are up to it. We will get through this. But be smart. Take every precaution and do your part. Take this seriously because it is serious. With that, I'll hand it over to Dr. Janae Khaldun.
Thank you, Governor Whitmer. We continue to see significant increases in the number of cases of COVID-19 in Michigan every day. As of this morning, as the governor mentioned, Michigan has 1,232 confirmed cases. As of this morning, we also know of 15 deaths. The cases are spread out across dozens of counties across the state, including the Upper Peninsula. It is affecting people across all ages, from the very young children to those over the age of 80. We've been preparing and responding for more than 2 months in the Michigan Department of Health and Human Services and with our dedicated leaders across all of state government. We were ready to provide testing in our state lab the day the CDC said we were able to. We have more than tripled the number of tests we can run in our state lab, and we have worked to build a system across the state where other hospitals and private labs can send us their data so we can share it with the public and accurately track cases. Now we can test at least 1,000 people a day, and that number continues to grow. We are also working diligently to make sure we can improve our reporting infrastructure so that everyone can get an accurate picture of the number of negative tests that are being completed in the state. However, we know there are many people who are still unable to get a test. As a country, we did not make tests available quickly enough to be able to fully understand the scope of the problem. We know that there is community spread in several areas of the state. Michiganders have come together to implement the important social distancing measures under Governor Whitmer's direction, decreasing large assemblages and not dining in at restaurants or going to bars. Now's the time, however, where we must do more, and we knew this day would potentially come. If we do nothing, very rough models estimate that the number of cases in Michigan could increase 5-fold.
Do you want people to call them to make sure they're not sick?
We are acting
Yeah, they want
right
to make sure
now
if
to
they said
decrease
if
that
you
number.
need to make sure to call if you
If
get
everyone
the
stays at
coronavirus,
home,
call your mammy
if they
now
only
because
leave
she's
their
sick.
home for essential reasons
And the
and
other girl
practice the
said
appropriate social
her team
distancing,
was
we
making
will slow the spread of the disease.
1,500 masks
I'm also
secure.
practicing
and a
emergency
hand
medicine
sanitizer.
physician, and I've had some very heartfelt conversations with my colleagues across the country over the past couple of weeks. There are ICUs across the country, and here in the state of Michigan, there are full of dozens of people with COVID-19, all of them on ventilators. Emergency departments are needing to pick and choose who gets to go on a ventilator and who does not. People who were previously young and healthy are now fighting for their lives. Our frontline staff in the hospitals and clinicians are working tirelessly around the clock, taking care of patients with COVID-19 while keeping up with the usual demands of a busy emergency department and a busy intensive care unit.
What's
We
your goal?
have to make sure that our hospitals can continue to do this very
It's on
important work.
Facebook.
And that they are
No, I'm not gonna shoot.
overwhelmed with patients who are severely sickened from this
Shoot,
disease.
he's watching from here.
These proactive public health measures are aggressive, but they are temporary. And if we all come together to implement them now, I'm confident we will slow the spread of COVID-19 here in Michigan. With that, I will turn it back over to Governor Whitmer.
Thank you, Dr. Calhoun. Be happy to open it up for some questions from the press.
How this next executive order will be enforced, will the National Guard be called at all, or how will it be enforced in Michigan?
So a couple of points. First and foremost, this is not a recommendation, this is an order, and we take it very seriously. This is about the public health of our people. We've ensured that essential services are still available, that if someone needs to go out and get food, that they can do that, and that the food supply chain is robust and prepared to meet the needs of people across the state. We've also ensured that if you need to do basic or gas with your car, you can do some of those fundamental things that are necessary for life. Go and get your prescription. But for any businesses that don't heed this order and are not essential services, I would anticipate that there will be fines associated with not doing that, and they will be shut. We have a moment to stem the crisis that we see unfolding before us. It is going to take all of us to take this action seriously, and that's precisely why this order is so important right now. With regard to questions about the National Guard, they are helping with humanitarian efforts, not on any sort of a law enforcement front, because we've got to ensure that food gets where it needs to be, that we are setting up temporary hospitals, temporary hospital beds, medical abilities to meet the need. And so they are helping in states across the nation, and it's in that capacity.
There won't be any checkpoints or anything like that, roadways, highways.
No, this is, at this point in time, what we are asking is that people recognize this is an order that they must comply for their own health, for the safety of others, and for the long-term health of our economy. Any businesses that don't comply, there will be ramifications for it, to be sure. And we have confidence that when Michiganders understand how serious this is, if you really have been paying attention, or if you're now suddenly starting to pay attention, you know that we all have to do our part. And for some of us, it'll look simply, doing your part will just look like staying at home. For others, it'll be staying at home and going online and making a donation to the
quality
food
is
bank.
terrible.
For others, perhaps they can call 211
really
and see if there's something they can do. Checking
real
in on elderly friends and neighbors. Over the whole
He's
FaceTime.
ugly.
There are ways
You have
of
no
coping
teeth.
with this. I'm not suggesting
Yeah,
it will
stop
be
commenting.
easy. But, if we all do our part, and that means business owners too, don't play fast and loose with what is essential and what's not. Don't try to skirt the rules. If you're not an essential business, you need to close, and you need to protect your employees. And we're confident that the vast majority of people are going to do the right thing. And we're imploring those who are maybe still uneducated in how serious this is, that perhaps now they will understand, because this is an order, and this is going to be something that everyone's got to be a part of following.
What about restaurants and carry-out, delivery services, things like that, are those still?
So restaurants, the carry-out, dine-out option is still something that is available to people. This is an essential service, which is the feeding of the people of our state. So grocery stores, convenience stores, the pharmacy, the restaurant where you can get your takeout, those will all still continue to serve the public. But we ask the public to, where you can make use of a delivery service, do that. Where you don't have to physically be the one to go out and get it, and there are others who are doing that, make use of it if it's available to you.
Governor, what white line is there for people to use to decide whether or not they're covered by this order?
So I think that, as you read the order, and I know you haven't had a chance to scrutinize all the language in the order, but I think it's pretty clear about what services are considered essential and whether or not you fall into that, those parameters or not. So I do think that the business community has had an opportunity to give some input over the course of our research and development of this order, and I think that we've made it pretty clear in the terms of the order.
This question is for both of you. You mentioned in the state governor about thinking of the healthcare workers who were trying to battle this, and there seems to be some inconsistency with the guidelines for those healthcare workers between state recommendations and CDC recommendations as to whether they've been exposed to a potential case. They would be asked by the state to keep working, but not to perform this. So my question is this state
You guys eat something?